Problems with testing. Just one reason a prominent retired ER doctor is giving the BC government a failing grade when it comes to its Omicron response. And she's part of an advocacy group of medical professionals now calling for a lockdown. CTV's David Malko joins us live tonight. And David, these experts have been pushing for more restrictions for some time now.
You know, it's all a tricky balancing act. That's really what you've got to remember here. And though these experts say when it comes to Omicron, our province has completely missed the mark.
Nobody wants to have to close things down.
But that's exactly what the experts who are part of the grassroots group Protect Our Province are pushing for. And now.
You want a grade? D, F? Take your pick.
Because Dr. Lynn Fiatro, who has decades of hospital experience, says while BC has been reactive nearly the entire pandemic, infectious Omicron has changed the game.
We're in a different game, a different pandemic now.
And our leaders' thinking and policy needs to be more nimble.
A 3-week circuit breaker allows us to regroup and shift to follow the science.
Something BC's top doctor and our health minister say they've been doing all along.
It has been another tough year.
Though these experts say we need to push pause now, so
everybody can up their mask game. Every business, including schools, long-term care and hospitals, can once and for all address cleaning the air.
We're not there yet in BC.
Because Dr. Brian Conway, who's not part of the group, points out it's the threat to our hospitals that really triggers the need for a breaker. And the data shows we're not there. Not yet.
The main problem we would have with stricter measures is would people follow them or try to find ways around them?
You have to be mindful of the fact that you can get lulled into a false sense of security. If you let businesses stay open, you're supporting the economy, but you risk allowing the virus to spread. And it's not an easy thing to know where that line is.
Yeah, he's talking about that line, David. You know, not everyone agrees that we need tougher restrictions, but is there something they all do agree on?
You know, more things than you actually might expect here, right? One, our hospital system, it still has the potential to be overwhelmed by Omicron. They all agree on that, with then spillover effects to those who may seek care for other reasons. If you have a heart attack and stroke, that's the big fear here. Dr. Labos, by the way, the last guy there, not part of the group here, but all of them also calling for more rapid tests, quicker booster shots, things BC is finally picking up the pace on after, as you know, Mi Jung, being widely criticized here for just not moving fast enough at all.
Yeah, well, Dr. Bonnie Henry will be giving her update, the first one of 2022 tomorrow, so I'm sure she'll be asked a lot of these questions.
Another year, work in progress.
All right, thanks, David.